Hi Monica, my name's Jackson. I'm going to be your physical therapist today. Before we get into the examination, I'm just going to talk to you a little about your history and what brings you in today. So, and while we're talking, I'm just going to be taking notes on my laptop, but I am paying attention to your answers. So, if you could, just in your own words, just tell me a little bit about what brought you in today.
I just had a baby a couple weeks ago, and I noticed when I was trying to get out of bed, I was really struggling. I couldn't roll from my back over to my side and up out of bed. And I know when I was pregnant, my OB said that I had pretty bad abdominal separation, so I just wanted to come in and see if there's anything I can do to get on top of it.
Abdominal separation is definitely something we see pretty frequently, so that's something we can work on together. And you said this that you gave birth about 2 weeks ago,
Yes.
and but did you notice these symptoms starting before that, or is that exactly when things you noticed your symptoms starting?
When I was pregnant, I had a lot of doming and coning that I noticed, but it didn't really impact me because I was pregnant and everything hurt and was not working properly.
Would you say it's been like 3 months since you started noticing the doming and coning?
Sure.
Yeah,
That's right.
that's about accurate. And would you say that you have a lot of pain in your abdomen or discomfort, or is it more just the weakness that you're experiencing?
No, it's not painful. I just can't move.
And I know you said that you have had difficulties with things like sitting up in bed or rolling over. Are there any other activities you've noticed that are especially hard for you? Especially like daily living activities like getting dressed by yourself, cleaning the house, bathing yourself, anything like that.
Um, Not really related to, I mean, I can't engage my core very well, but I wouldn't say my activities of daily living have been impacted too intensely. It's just my ability to like pick up things up off the floor, and if I'm sweeping, bending down to get the dust off the floor.
Okay. So cleaning and lifting heavier objects. Right. And have you found anything so far? I know this is your first time coming to therapy, but have you found anything on your own that has made any of your symptoms better or worse?
I tried some YouTube workout videos, but I haven't seen any improvements yet.
Well, I think getting a start on that early on is an awesome thing, and we can definitely continue working on exercises here. And could you just give me some examples of like what kind of exercises they had you do?
Just like laying on your back and moving your heels up and down, heel taps, and breathing, a lot of breath work to try to engage your core.
Right, I think that's a really good start. Okay, what about anything that you've noticed makes your symptoms worse?
Trying to sit up.
And I forgot to ask, is this your first child?
Mhm.
Well, congratulations on that. I have one child as well. And let's see. Are you taking any medications right now?
Um, I I just got off of like painkillers from my delivery. Just like
Okay.
I was just like that one.
Okay, so some
IV.
anti-inflammatories. You said your OB/GYN is the person who first diagnosed you with that abdominal separation.
I wouldn't necessarily say diagnosed. She mentioned that that happens with abdominal separation.
Okay. Did she take any measurements or anything? Okay, well that's something we'll probably do in the future just so we can kind of track our progress with things. And next, I want to know a little bit about your family's medical history. So do you or anyone else in your family have a history of things like cancer, diabetes, and chronic illnesses?
Yeah, my grandparents have had cancer, and then I have a half sister who's a diabetic, and that also runs on my dad's side of the family. I have some uncles and an aunt who are diabetic.
And are you aware what type of cancer specifically?
Uterine cancer, and then I think we just had like skin cancer.
That is good to know. Alright, and then next I just want to learn a little bit about your daily life, home living situation. So in terms of your house, are you able to like get around your house pretty easily?
Yes.
Not a ton of stairs or anything like that?
You have to go upstairs to enter the main living area, but then it's all one.
Okay. And it's not too hard for you to get up those stairs?
No.
And how would you kind of describe your level of activity right now compared to what it was before you became pregnant?
Non-existent.
Non-existent, okay. And how would you have described it before getting pregnant? Like how we were
moderately active, yeah. I would work out like 3 or 4 times a week.
Okay, and what would you say are some things that you like to do for fun, like recreational activities, before getting pregnant or now?
I like to hike. I feel like it's pretty hard to do that when I'm not able to engage my core and breathe properly. I liked going to the gym and just hanging out with my family, watching shows, seeing my friends.
So would you say hiking and going to the gym are probably the things that have been most effective?
Yes.
Okay. I think hiking is a great recreational activity. What's your favorite place to go hiking?
I don't know if I have one yet.
Yeah. Well, I think you should definitely check out Big Cottonwood Canyon. There's some good hikes there. Okay. And in terms of like I think you said you don't really have any issues with your activities of daily living. Would you say you're pretty much fully independent at home?
Yeah.
Like don't need assistance with any of those things we talked about earlier?
No.
Alright, and could you kind of give me a brief description of how you feel your overall health status is right now?
I think I am recovering significantly from pregnancy and delivery, and I'm not in peak health.
That's very understandable. Alright. And then I looked over your intake form and looks like you said no to most of the questions, but there are a few things I wanted to ask you about. I noticed that you said that you do have moderate difficulty sleeping. Could you elaborate on that a little bit for me? In terms of like how many hours of sleep you feel like you're losing, what kind of quality you would describe your sleep being?
I think I'm probably getting 4 to 5 hours of sleep a night, mostly due to my newborn, not due to my abdominal separation.
That makes sense. Yeah, that was pretty much the only thing I noticed on your intake form. Was there anything else you feel like you needed to let me know that I haven't asked you about yet, or like wasn't on an intake form that you feel like would be important for me to know in terms of our working together?
No.
And just to kind of review, get an overview of how the rest of your body's doing. So unrelated to the abdominal separation, do you feel like you have any muscle weakness or tightness in other areas of your body?
Yes.
Where would you say that is?
I am breastfeeding, so I am often hunched over my baby trying to breastfeed. So I think my back and neck muscles are very tight and weak. I just think overall my lack of activity during pregnancy has weakened all of my strength.
Everything? Okay. Well, those are different things we can look at as well. And then, let's see, would you say you're able to do things like light activity, like walking, without getting out of breath or having your heart rate increase dramatically, or are things like that difficult for you?
I think I can walk normal.
And other than that, have you noticed any, since giving birth, have you noticed any like unexplained rashes, redness, or bruising anywhere on your body?
Mm.
Alright, now I just want to talk to you a little bit about goals. So, what would you say some of your most important goals are for therapy?
I really just want to be able to feel strong and like I can do things everybody else can do without struggling.
I think that's a great goal. I think also you mentioned some things that were difficult were the rolling over in bed while you're laying down, sitting up from laying down, and then like lifting objects around the house. Are those things you would say are important for you to improve on?
Yeah.
I think
Summarized in my first goal though.
yeah. I think I agree. I think it's just good to be specific so that we can get some like measurable improvement as we're working together. And then I would also say, I think another good goal would be to reduce the amount of abdominal separation that you have. So that's something we'll probably measure, and then as we get you stronger, we'll continue measuring so we can see improvements that we get there. Alright, well that's all the questions I really have for you. I just want to kind of recap everything we've talked about and just let me know if anything sounds wrong or if there's anything you want to add. So, coming into physical therapy because you're pregnant, had your baby 2 weeks ago, struggling a little bit with mobility in bed, sitting up, and mainly the abdominal separation and weakness is impacting your daily life. And it started kind of occurring around 3 months ago, but really you started to notice it after giving birth. You noted that it's not painful, but it's just not as functional as you would like it to be. And some things that are difficult are like picking things up off the floor and cleaning. You've tried some workout videos to kind of strengthen your core, but haven't noticed a lot of progress yet. And that kind of involved like laying on your back, doing core exercises and breathing exercises. Only medications you've been taking are anti-inflammatories like Advil, but stopped that recently. Did not have any labs or imaging done. And in terms of family history, grandparents have had cancer before, uterine and skin cancer, and then some diabetes on the dad's side. And then your house has been not difficult to navigate for you, but your activity level is lower than you'd like it to be, and previously you were working out about 3 to 4 times a week. And then some recreational activities you haven't been able to do recently are hiking and going to the gym. And overall you feel like a healthy person but recovering from delivery, which is understandable. And then some moderate difficulty sleeping, and overall muscle tightness and weakness kind of throughout your body. And then goals, we have just getting back to feeling strong, being able to do normal things without struggling, and then specifically working on rolling over, sitting up from laying down, and just lifting heavier objects, and then reducing kind of abdominal separation. Does that all sound pretty accurate to you?
Yes.
Alright, then I think we can move on to the next stage of treatment.